if you have a tumor that starts growing,
Where does it go?
well, where does it grow?
Where does it go and where does it grow?
Where?
That's the problem.
That's the problem. So it keeps on pressing on the brain. The brain is locked in the skull, and it causes more and more symptoms, or it destroys the nerves. So
and it just gets bigger and bigger and bigger.
Right. So you have to stop it or shrink it or make it go away. So acoustic neuromas are benign tumors. This woman came in 3 years ago. She saw neurosurgeons about open surgery, and she understood that if you have open surgery, most likely she'd end up deaf and a high degree of damage to the facial nerve, which means her face would be paralyzed.
And she'd have some sort of drooping almost of her face.
Drooping. She couldn't close her eyes.
Sure.
If she drank soup, soup would
spill
fall
out
out of her mouth.
Yep.
She tried to smile. One half would smile. The other half would be falling down. So surgery for acoustic neuromas and a lot of brain tumors are not exactly the most desirable method. She investigated gamma knife treatment 3 years ago. She did not want those screws screwed into her skull. There's 4 screws go through the scalp, into the skull. It is painful. And there's only one treatment. And when you give one treatment, you don't get the benefit of fractionation. Doctors have known since the 1920s that if you divide up the dose into a few treatments, you get protection of the healthy tissues.
Yes.
Right. So we stopped gamma knife style treatment for brain tumors in 1993. So it gives you an idea how long
20 years ago
we've been doing it. Most people haven't even started. Many of them weren't even in college back then. And we stopped gamma knife style treatment because number one, it was painful. Number two, it was toxic, and people just didn't like it.
and you have the better scheme now.
There's a much better treatment. It's called fractionated stereotactic radiosurgery for brain tumors, for acoustic neuromas, meningiomas, pituitary tumors, metastasis, and it allows us treatment without pain.
So what does the treatment entail?
Well, there's a head frame that goes on over the head. It's custom made for the patient. We do computerized planning. We can find the tumor and send in beams just to hit the tumor. It takes about 15 minutes. They get up and go to Starbucks or go home or go to work or do the things that they want to do, not get laid up in the hospital.
And how many days, over how many times do they have to come in?
We have a unique program for acoustic neuromas. It's 5 treatments. Each treatment's about 15 minutes. They come in, get a treatment, and go about their business. Our success rate for acoustic neuromas, we have the largest experience in the world treating acoustic neuromas with fractionated radiosurgery. We've treated over 1,000.
Wow. What's the percentage?
The success rate's 97%.
Wow.
So it's higher than with surgery.
Sure.
And you don't get the toxicity of surgery. You pretty much feel the same. Most people feel absolutely nothing. And for this woman, her tumor went from 8 millimeters 3 years ago to 28 millimeters now. Okay,
almost
in 3 years.
350% almost?
Okay, so 350%, that's 3 times, right?
Yep.
You guys are saying
3
you guys are smart guys 3 times. But someone out there in the audience knows that you're talking about the diameter.
Yes.
Now, a tumor has volume.
Right.
Now, if you're going to figure out a pizza, if they're selling you a 9-inch pizza and an 18-inch pizza, the 18-inch pizza is more than double the area, right? And you have a volume, you have a third dimension. So for acoustic neuroma or other brain tumor, it's actually proportional to the radius, which is half of the diameter, right, to the third power. So if you get something that was 8 millimeters and it grows to 28 millimeters, how many times bigger is that tumor? This woman's tumor, how many times bigger is it? Did it grow in 3 years?
I'm not sure how many times bigger, but the space...
Well, I am.
I know, I'm sure you did the math, but the space it can occupy, I bet you, is the same.
Well, that's why she's having more and more symptoms.
Symptoms.
Right.
Okay, so if any listeners can tell me, what's the increase in volume of this acoustic neuroma of this patient? It went from 8 to 28 millimeters in 3 years. Please call in 212-CHOICES, 212-CHOICES. We're going to go to a word from our sponsor, the man with the golden voice. For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. At Radiosurgery New York, the radiosurgery pioneers, that's our goal too. We're first in America, first in New York, first for you with body radiosurgery. We hit your cancer from head to toe with no cutting, no bleeding. We have decades of experience with primary and metastatic, large or small cancers. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are the best results and quality of life. Hi, I'm Dr. Gil Lederman. For a free booklet and DVD, call 212-CHOICES. 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. We're super convenient, Broadway and 38th in Manhattan. Hyperthermia 2. To hit your cancer, call 212-CHOICES. 212-CHOICES for Radiosurgery New York. At Radiosurgery New York, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Custom prostate cancer treatment here is outpatient and takes as little as 1 hour. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid accepted. Hi, I'm Dr. Gil Lederman. Call us at 212-CHOICES, 212-CHOICES for a fresh second opinion and a free booklet DVD. Conveniently located in Manhattan at 38th and Broadway. For your custom-tailored prostate cancer treatment, call 212-CHOICES. 212-CHOICES. Cherish your life with custom-tailored prostate cancer treatment at Radiosurgery New York.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
We're back. So that woman, that beautiful woman whose tumor went from 8 to 28 millimeters, acoustic neuroma, it increased, you're right, Ariel, by 44-fold, 4,400% bigger today than it was 3 years ago, calculations based on a sphere.
And the space is the same in the skull.
The space in the house, so that's why she's having more symptoms. So
Yeah,
I believe
sure.
she's coming this week to start fractionated radiosurgery for her brain tumor for acoustic neuroma. And I urge other people, if you have a tumor or know your friends, give us a call because you may want non-invasive treatment rather than cutting, bleeding, and the complications of surgery. I want to talk about a kidney cancer. I know, Ariel, you saw a patient this week with kidney cancer, and you actually presented data for kidney cancer in
Holland.
Amsterdam. You went to Holland, and you presented data of radiosurgery for kidney cancer, both in the kidney and spread.
Yes.
And what's the data look like?
The data is very good. We can,
So how good is it?
up to 87% control for a kidney cancer.
So that means that the vast majority of patients, once when they're diagnosed with a kidney cancer, either in the kidney
Or outside of the kidney.
or outside metastasis.
Not including the skull.
Well, we also treat brain
Yes.
tumors, so actually the success in the brain is equal. The success rate's around 90%
Yes.
for treatment to stop, shrink, or make it go away. And this is a cancer that many people
We'll do surgery for.
do surgery for, and even many radiation oncologists still believe that you need to operate.
Or they won't even touch it.
Right. So we have the largest experience in the world. We were the first to treat kidney cancers with radiosurgery.
And you've treated hundreds of them.
We've treated hundreds, so it's a very nice experience. We have Dr. Eisen on the line, and we're running short on time, but we want to speak to Dr. Eisen. Buenos dias.
Buenos dias, Dr. Lederman. How are you?
Now, we know you have some interesting cases. Dr. Eisen is a Spanish-speaking doctor. He dedicates his life to the Spanish community, people who need cancer care, and he's available 24/7. So tell me about your week's activities and your most interesting cases.
Well, one of the cases was very interesting. It was a person that came with a big mass on the left neck.
Now, that was someone who had a mass almost the size of a fist in the neck, right?
Exactly.
And he had a lymphoma 15 years ago and was treated and is in remission from that, right?
Right. And he was very concerned. At the same time, he was kind of waiting and waiting and waiting.
He waited, I think he waited 2 years, right?
Right.
He waited 2 years, and in one day, you got all the tests necessary. You got a biopsy, you got a PET scan, you got everything, a physical exam, and a history in one day.
And we have a wonderful workup and labs and X-rays, and he's already coming on Monday to see us, and he was so happy and able to speak his own language because he was very afraid about that. He's originally from the Dominican Republic, and he was able to speak Spanish, and we explained everything. And that's what makes the difference in the patients, and be able to express themselves. And that was very, very good.
So you're going to have an answer for him on Monday, whether this is a recurrence of that lymphoma that he had 15 years ago, or whether it's a new cancer, head and neck